One of the problems with transformative integrative medicine is that it's been marginalized. It's been attacked. You have to fight for your integrity. And also, the standards of evidence that are used to test pharmaceuticals or to test surgical methods are based on assumptions which are really different than the assumptions that drive your practice. So the marginalization persists because people are expected to produce evidence of efficacy. But the way that efficacy is judged in mainstream medicine is by getting people who walk in the door and categorizing them as having all the same thing, and then performing the same procedures on them and the same metrics. And then you judge whether the placebo group experiences less change than the group that's getting the treatment. But it was never true that the 50 people who walked in the door with back pain all had the same kind of back pain. It's never been true. That's a mythology in the first place, because everyone has their own unique structural and organ system weaknesses that contribute to the way they're having back pain. They have their own unique leg length differences. They have their own unique minor and major trauma histories. And that's never been something that was taken into account systematically the way evidence was generated. Whereas in transformative medicine, it's the very act of taking that stuff into account which makes it transformative for that person. So we're faced with, we have to establish a playing field on which the integrity of this individualized approach is the standard and the legitimate standard that we follow. And we also are in an era where we have all these lab tests, genomics and omics this and omics that, these fancy lab tests, and people are talking about personalized medicine and predictive medicine. But really, the truth is that those laboratory techniques are not there yet. They're just not. I mean, you get this big printout of all these labs, and it doesn't really tell you what to do with that person. It's still guesswork. In many of the transformative practices, there are palpatory techniques and perceptual techniques, which, particularly when you use patterns related to acupuncture meridians or other systems, that give you tools where you actually have real-time ways of assessing the patterns of vulnerability in a person, and you have ways of shifting them in a short period of time, and then using those same methods to see what you did and what to do next. And to me, I see that as an already existing form of personalized medicine, somewhat predictive. So, but we don't have a culture we have a culture of using these very sophisticated, complex perceptual and palpatory systems to make clinical judgments, but we don't have a culture of tracking it. And so so I'm working with a number of different types of practices right now. So I'm working with the Lydian Center. I'm also working with Anat Banyel, with some osteopaths. And so what happens when I work with several practices at once is that I see individual differences. Like here, there's the issues of structure and how do you track structure and symmetry, and what outcome measures do you want to use? And they're not the same from each practice to each other practice, but there's underlying themes that are common across the practices. So in order to build community around doing the research, there's intellectual activity that needs to go on around what is the specific set of procedures and questions that you need for your particular style of practice, and then what are the common issues that are facing different practitioners, so that we can have a community based on common interests, even while respecting the unique approaches that may characterize a particular practice or a particular methodology. So I'm committed to setting up that dialogue so you have this kind of grounded inquiry process where you're looking at what you're doing, you're realizing that we need to measure it partly because we just need to defend ourselves, and partly because we might actually learn some things. And we also have a lot of drag from integrative practitioners or transformative practitioners who have been frankly humiliated by the establishment. Like I was at an osteopathic meeting about research. And people who are extremely highly competent practitioners will still turn around and try and design studies as if they were drug studies, because they feel like they have to have a placebo-controlled study. And it isn't the only kind of study possible. There are many different kinds of study designs. And if you go back and you do that kind of study design, you're going to fail, because you can't blind treatment, so you need to come up with other treatments. And there's even just a simple thing that's used in psychology all the time, the single subject design, where you measure somebody, then you measure them again, and you compare them against themselves, is a well-established procedure in psychology. Hasn't gotten very far in medicine, but it's statistically legitimate. So, I'm waiting with bated breath for David Jones from the Institute of Functional Medicine to come out with his white paper that he promised by the end of the year, taking apart evidence-based medicine standards of evidence from a statistical point of view, just ripping it to shreds. I mean, he promised this in April at a meeting I was at with him. And he's been doing this, and if you look at his 21st Century Medicine white paper, which came out a few years ago, Medicine for the 21st Century, from the Institute for Functional Medicine, he has a section in there talking about this, but he's going to go into it in much more detail. We really need that. We need to, because he said at this meeting, he was quite passionate about it, he said, if you think that this is a problem, when you study the statistics, you'll see that it's even a bigger problem, that this stuff is very poorly grounded, the way that evidence has been. The standards that people have held up as if you don't meet these standards, you don't have evidence, that those standards are not very good. It's really, remember Toto in The Wizard of Oz? And Toto pulls back the curtain and he says, pay no attention to the man behind the curtain. Well, the man behind the curtain is a little guy. Anyway, it isn't very good. So that to me is sort of a metaphor for our age, and a lot of the stuff is coming undone, but we're not really all the way there yet, and a lot of people who should know better are still, they've really been humiliated by being told their stuff doesn't work based on standards which are completely ignorant of what they actually do, set by people who can't do what they do and have no concept of it. So ultimately, what we really need to do is turn the tables.